Good evening. I'd like to call to order the meeting of the Caldwell County Department of Social Services. And today is Tuesday, June 24th, and it's just a little bit after 5 o'clock here in the Out in East Orange building. We'll start our meeting today with the Pledge of Allegiance, followed by the invocation by Pastor Eric Bartell from the Life Together Lenore Presbyterian Church here in Lenore. That's a mouthful, Pastor. Everyone face the flag. Salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Director. Thank you, board members.
Thank you.
If you'd please bow and pray with me. Dear wise and loving God, let me say thank you on behalf of all gathered here this evening. Thank you for your many blessings. Thank you for life itself, for the measure of health that we need to fulfill our callings and the sustenance for our friendships. Thank you for the ability to be involved in useful work and for the honor of bearing appropriate responsibilities. Father, I do ask for your provision, your blessing. Father, I ask for you to be with those today and in the days to come where heat like today is crippling. Heat like today is imminent and present danger. Father, we know there are many in this county that do not have the luxury of air conditioning like we have here this evening. We thank you for that, but also pray for all of our citizens, Lord, that are suffering. Please be with them. Please be with them from your boundless and gracious love. You have said that citizens ought to obey their governing authorities, since you have established those very authorities to promote peace, order, and justice. Therefore, we pray for our city officials and particularly for this assembled gathering this evening. We pray you graciously grant everyone wisdom to govern amid the conflicting interests and issues of our times, a sense of welfare and true needs of our people, confidence in what is good and fitting, personal peace in our lives, and joy in the task. We pray for the agenda set before all of us today. Please give everyone assurance of what you would please do and what would benefit those who live and work in and around our beautiful and beloved Caldwell County. It is in your most blessed name we pray. Amen.
Amen.
Thank you.
Thank you.
Thank you, Pastor. All right. Any amendments to the agenda?
Yes, we are going to have to remove item 6 from the agenda tonight. Our social worker that was going to be here is actually out investigating
6?
a report, so
Okay.
he's not going to be able to be here.
So that's the only change?
Yes, that is the only change.
All right. I need a motion to approve the agenda as amended by the director.
I make a motion to approve the agenda as amended.
Second.
All in favor, please say aye. Aye. All opposed, motion carries. Next, I need a motion to approve the minutes from the April 29th meeting as well as the May 27th meeting.
Motion.
Second.
Have a motion and a second. All in favor, please say aye. Aye. All opposed, motion carries. Next item on the agenda is a decision item, the Energy Outreach Plan, and we're blessed with Ms. Patterson tonight to give us that, Customer Service and Energy Supervisor, and Brandy Hood, Economic Services Program Administrator. Y'all's number has been called. Not the number, Ms. Patterson, just a number.
So I'll just briefly go over what we're going to need tonight, and then she'll explain a little bit about the plan. So we do this every year. This is our energy outreach plan, and this will just be pending the approval of the board, so we can submit this back to the state. And
Okay.
then Mary's going to go over a little bit of the details of the plan.
All right, good afternoon, members of the board and Ms. Arnett. How's everybody doing this evening?
Doing great, hope you are.
Doing well.
Good.
So I just want to give you a brief overview of the plan, and I know you've already received that, but where does this plan derive from? And it's from a federally funded block grant program that consists of 3 programs, which is the Crisis Intervention Program, known as CIP, and the LEAP program, which is the Low Income Energy Assistance Program, and weatherization. Now, at Department of Social Services, we only deal with the CIP and the LEAP programs. So what does this plan do? And I can't say any better than it's already written. So it's
Yeah.
a framework to ensure that eligible households are made aware of assistance available through these programs. So let me tell you just a little bit about the programs that we do deal with. The SIP program, which is crisis intervention. And it is what it is. It says crisis, and it's for households that are in crisis. And it is for heating and or cooling, and it's for households who are in danger of disconnect or have been disconnected or have a notice to disconnect. And so what this program does, it helps alleviate those crises for those families. It is a year-round program. It is from July 1st, 2024 through June 30th, 2025. So we're at the end of this year. We're getting ready to go into a new energy year, our fiscal year. And it is for anybody that's income-based, but anybody can apply. But that is for a help for crisis situations, to help those families. A family can be allotted up to $600. That's the maximum allowance. So they can apply multiple times. They can apply over and over again, not to exceed that $600 maximum allotment. So our low-income energy assistance program is for a specified time frame. It's also income-based, but it runs from December 1st, 2024 through March 31st, 2025. So in December, though, only those that are 60 or older or has a household with somebody 60 and over can apply. All other households are eligible to apply that first working day of January. And it's just a one-time vendor payment to that energy vendor, and it is for heating only, whereas SIP is heating and cooling, LEAP is just for heating. And those increments are in $300, $400, or $500. And again, that's made directly to that payment. And that's just a program to help families with their utilities. And of course, that's
one time per year then?
one
they
time
get
per
that? Okay.
year. Yes,
All right.
within that time frame from December to March, it's
Okay.
just one time. Whereas SIP, they can apply multiple times.
Okay.
Yeah.
So again, like I said, this plan is for outreach, is what it says. So how do we do that? How do we do this plan? And it is, we form committee members. And what that means is that we partner with different agencies, different people, organizations within the community to ensure that they receive this information as well for the program, so that what the program is designed for, the plan is designed for, so that these families can be aware of the programs that are available. So what we do meetings twice a year, normally it's in October and April, to prepare for the LEAP season that will be coming up, and then for the summer months, the cooling season. So we, as we get information from the state, we process that and we send that along to our partners so that they will be aware, so the information can be current, and so that families, again, will be made aware of programs that are available for them. So that's one of the ways that this plan works. We do have a target audience, which is anybody under 5, households with children under 5, and anybody 60 and over. So as you see, you have a list of our energy members, our committee members, and you can see it's not just energy vendors, but it's daycares, it's the school system, it's the senior centers, it's the library. So anywhere that we know that families go or people go to access their services, so in turn, they can have access to the energy services as well. And as you read further along in the plan, we talk about media. Media has been a vital, important part of what we do and get that information out. We do access our program here, and I think in November is when we do that. In November, we do a program on the LEAP season and energy so that families can be aware. We have social media. The Department of Social Services has a website. Even the county has a website that we put the information on as well. And we run the newspaper, normally does articles, and we have a radio advertisement that we do. So we try our best to use all the outlets that we can to get this information available to families to apply for these services. And our best practices, what I want to end on, is that we partner with some of the best people in Caldwell County. And with how things have gone, we have relied heavily on, I want to give a shout out to Yoke Fellow with Ms. Sharon and the United Way with Ms. Jamie, because for this year, we received our SIP monies in July. By October, we had exhausted our monies.
Yeah.
We did receive another small allocation in December, but within a week, that was gone as well. But then we were in LEAP, so that kind of took away some of the stress of not having our funds. But then for LEAP in January, the third week of January, we exhausted those LEAP funds. We have never done that and ran out so soon.
Yeah.
So we did rely on our partners. We make referrals to Young Pella, and then with United Way, we're able to access, they give us monthly allocations, so we're able to help families in need. And that's not just for heating and cooling, that's for rent, deposits, water, because a lot of people need help with their water assistance. So we're just very fortunate to have agencies that we partner with within this county. And so this plan that we do every year is just to ensure that we are better able to help the citizens of Caldwell County. And so
Well, that's great.
if you have any questions, feel free to ask.
I
But,
don't
every
think
year
so. I
we
think
do-
we're all fairly familiar with it,
Yeah.
but,
Yeah.
And you explain it very well.
yeah,
Oh,
you did a
well,
great
thank you
job
so
explaining
much.
all of us. So thank you so much
Thank
to
you.
both of you.
Thank you, thank you.
Y'all have a great evening.
Thank you.
Next is our reports, Adult Protective Services presentation, Ms. Beverly Rupert, Adult Services Program Manager, and April is going to talk to us about, and we make sure we clarify this.
World Elder Abuse Awareness.
There you go, I
Yes,
like that.
yes.
That was better than what I was going to say.
Yes, so before we do that, we do need to make a motion to.
Oh, that's right, we got to go as
approve
a
the
decision
outreach plan.
item. My
Mhm.
apologies, my apologies. I need a motion to approve that energy outreach plan.
Motion.
Second.
All in favor, please say aye. Aye. All opposed, motion carries. Now, I know you've been waiting all day for this.
I have them, it's so excited.
We're really going to watch closely. We're going to listen closely and watch you. So,
I'll do a perfect
She'll
job.
do a great job.
yeah.
Okay, as we know, June is Elder Abuse Awareness Month, so I thought we would hit the highlights of adult protective services.
Okay.
That is one of the most vital things in helping protect our citizens. I'm not gonna go through every slide, every detail. I'm just gonna kind of summarize, and that way our viewers can kind of understand too. We have the North Carolina law that mandates that local departments of social services provide protective services to all adults who are disabled. Everyone is a mandated reporter, so if you feel someone is, anyone that's disabled, which is 18 and over, is being abused, neglected, or exploited, you're mandated to make a call to DSS. A disabled adult is any person 18 years of age or over, or any lawfully emancipated minor who is present in the state of North Carolina and who is physically or mentally incapacitated. And then there's it can be physically incapacitated, it could be due to advanced age, a brain injury, there's many things, but the main thing is the person has to be incapacitated. Such as the adult must be alleged to be incapacitated due to a disability to be considered a disabled adult. And what that incapacitated means is, does their non or reduced functioning necessitate reliance on others to meet their basic needs? Okay, whether that is helping them physically or, helping them get to doctor's appointments, calling their medicine, that type thing. So to call in anybody who has a concern of abuse, neglect, or exploitation for an adult, if they'll just call DSS, they can give us a report, the information we need. And for a report to be screened in, there's a criteria it has to meet, and it has to meet all three of these criteria. It can't meet just one or two, it has to be all three. They have to be disabled, according to the previous definition. There has to be an allegation of abuse, neglect, or exploitation. And it has to be an allegation, it has to have happened. We are not preventative. We do get a lot of calls that, if you don't go do something, then something's going to happen. We work with adults. Adults have the right to make bad choices. So the allegation, something has to have already happened before we can actually step in. And they have to be in need of protective services, meaning that if we don't go out and do an assessment, then there's a high need that nothing's going to change. They need protection from the environment they're in. The definitions, we have abuse. When we screen reports, it's either abuse, caretaker neglect, self-neglect, or exploitation. Abuse is the willful infliction of physical pain, injury, mental anguish, or unreasonable confinement by a caretaker. For us to have to screen it as abuse, it has to be from the caretaker. Then we have neglect, which we have two kinds. Caretaker, which is failure of the caretaker to provide services necessary to avoid physical harm or mental anguish and to maintain the mental health of the disabled adult. Then there's also self-neglect. That's when there's not a caretaker in play. It's a disabled adult who's living alone and has no caretaker or is not able to provide for himself the services which are necessary to maintain his mental or physical health. And then last, we have exploitation. That's the illegal or improper use of a disabled adult or his or her resources for another's profit or advantage. Exploitation seems to be on the rise more with, especially with a lot of the scams we have out there now.
Yep.
A lot of elderly adults are being targeted for that. And I will tell you, that is such a hard report to evaluate because, you know, these scam artists, they know what they're doing. So, okay, once we screen a report in, it meets all three of those criteria, then we have to do a thorough evaluation. We have to determine whether the adult's disabled, is there abuse, neglect, or exploitation, and are they in need of protection? And then if we determine those things, we also have to determine if they have the capacity to understand the situation and consent to protective services if needed. If it's determined that they're in need of protective services, services will be offered and implemented. Court orders and petitions can also be pursued. If someone has capacity and we go out and offer them services, they have the right to decline or accept. If they do not have capacity to understand their situation, then that's when we usually have to go to court and get a court order. And that's hard for a lot of times for the public to understand is why someone won't accept our help. But like I said, you know, as long as the adult understands, they have the right to turn down those services. And capacity.
But let me ask you this question, let me get this right. If they have the capacity to turn it down, but they still are not taking care of themselves, is that what you're saying? You can still, but that's when you get a judge's order,
I can still
right?
be not taking my medications, or I can choose not to go to dialysis. But if I understand the consequences of my actions, then I have capacity and I can refuse services.
So when you were talking about a while ago, and maybe I missed it or I misunderstood it, is there are times when you can get a judge involved.
That's only if we determine the person does not understand, they do not
Okay.
have capacity.
All right.
So if I go out and see this person, they're not going to dialysis.
Yeah.
Oh, nothing will happen. I really don't need dialysis. And they don't understand that, no, without dialysis, you could die. Then we would have concerns about their capacity.
Okay.
And at that, I mean, there's other things we take into consideration. I mean, but if we determine that they don't have capacity, then we could go to a judge and get an order.
But if they do have capacity, there's really nothing you can do.
They have the right to make bad choices.
All right.
And capacity refers to adult's ability to fully comprehend his or her situation and exercise judgment regarding to the services that are protective in nature. So when we go out and do a protective services report, what we confirm on is the area that they need to have capacity in. Meaning, if we confirm that they're not taking their medications and they're not going to dialysis, that's the area we're looking at capacity. We're not looking at, does he pay his bills okay? Can he remember his neighbor's name? We're not looking at overall capacity. We're looking at capacity in the area that he needs protection.
What if the person is mentally, has the capacity mentally, but don't have the capacity physically?
This is mental
Like they
capacity.
can't get out of bed, they can't walk, they can't, it's only mental capacity.
Yes,
Okay.
we have plenty of people who are bedbound, and we get a report, you know, if their house catches on fire, they can't get out.
Correct.
As long as they understand that, they can choose to
Okay.
stay. And we've had ones that it's very hard because they do have capacity, they're bedridden, and they don't have any help.
Correct.
So that leaves us scrounging for what services can we put in.
Yeah.
And
That's the
that's
reason I
if they
was- 'cause that
allow
comes
us
up
to
a
put
lot.
in services.
That
Some
comes
do
up a
not-
lot.
Mhm. Some
Yeah.
don't allow us to put in services.
Some
Yeah.
will just refuse to accept any services, and we know that they're in danger if something were to happen,
Yeah.
and they have the right to make that choice.
But if they're able to make that choice, I mean, we don't have the right to
Right.
overreach.
And that's why we have to do a thorough
Yeah.
evaluation.
Yeah.
Right.
We have to have the necessary information to back up our decision.
And they do, I mean, they really look at, when there's a situation, let's just use the refusing to take their medication, because that's one that comes up quite frequently.
Yeah.
And they really look at and ask questions to really get at whether or not this person understands. Now, they may not know the names of their medication. But a lot of folks, they don't know what the name of it is, but they'll say.
I don't know what the name
take-
of it is."
Right, I take this heart medicine, I take this
Yeah.
medicine for my sugar, I take this, and they know if they don't take it, then the consequences could be I'll get really sick and I could die. Just because they don't know the name, or they don't know the dosage, or they don't know who prescribed it, doesn't mean they don't have capacity.
Yeah.
As long
Yeah.
as they understand the consequences of not doing it.
Right.
And we go to different times of the day. Like, we may go see somebody first thing in the morning, and we're like, gosh, they were kind of off. So we go back in the evening or back in the afternoon. We go different times of day to make sure, is it a situational thing? We review medical records. We talk to collaterals. We talk to people involved. It's a big decision because, we're adults. And to say someone lacks capacity, that's a big thing.
Yeah, and the
So-
reason I was asking is I think sometimes people, the general public, don't understand in many cases that we just don't have the ability to do some of the things that people want us to do, they think we should do.
Right.
That's the reason I was trying to get you to kind of expand on it a
Oh,
little
yeah.
bit. 'Cause-
People have a right to live the way they want to.
Yeah,
And just because I wouldn't choose to live a certain way doesn't mean their way's wrong.
correct.
Hoarding is a big thing, and people
Yeah.
can't understand that. But if the person understands that they're in a hoarding environment, there's nothing we can do about that.
Yep.
They may have, food out, rats, beds, bugs, roaches,
Well, I do know that in many cases, our staff has gone in and cleaned up houses and things of that nature for people because they just didn't have the capacity to do it. They knew it was bad, but couldn't
Physically,
do it
yeah.
physically. So
Right.
y'all, I know in many cases y'all go out and clean up and
And
try
that's
to
why
help
we
people.
give them
So-
that option
And that's
for
over and beyond. We
services.
don't necessarily have to do that.
Right.
We just do it
Right.
because we care, so.
yeah.
And that goes toward the prevention services as well. Like, we aren't preventative, and I know that doesn't sound good, because we all would love to be preventative. But it's very similar to child protective services, adult protective services, and law enforcement. We can't intervene until something happens.
Yeah.
Because people have rights. And
Yep.
so we just can't go knock on someone's door and say, someone's worried that something might happen to you. It has to be something has occurred.
Yep.
And that's hard to understand, and sometimes it's frustrating for us too. It's just, again, people have rights, and so we.
And
have to-
I know that we do a really good job of trying to, if we encounter a situation, that we do try to encourage the client or people to try to talk to them and kind of get them to where they need to be, right? And get them kind of thinking the way they need to be thinking. So I know we do a really good job of that, so.
Yeah.
And some calls we get, and it will not meet the criteria to be screened in. But we're looking at it and we're like, this is really bad. This is really bad. We'll screen it as an outreach. Difference is, Adult Protective Services, we have to do an investigation. We can get medical records. We can do what we need to do. Outreach is voluntary. So we go out to that client's house and we're like, hey, we have some concerns. Would you like us to sit down and assess your situation and see if there's some services? Sometimes they're like, nope, get out of my house. Other times they're like, sure, come in. So we do have a little leeway there,
Yeah.
to
Okay.
where.
Yeah.
So, and to make a report, 24 hours a day, 7 days a week, 365 days of the year. During working hours, they just call the 426-8288. And after hours or holidays, they can call the sheriff's office. And if anybody has a question about whether they don't know if it's a report or they're not sure what the person would need, if they call that intake line, we have one employee, that's all she does. And she's very versed on the services in the county and whether or not you need to make a report. So I would suggest just calling her and talking to her.
Okay.
And then I was going to statistics. We're pretty much stable. In 2023, we had 430 reports received. 272 reports were evaluated.
The space bar down there. See if we'll go.
Nope.
She'll have to do it in there.
Last year, we had 446 reports received and 269 evaluated. There it is. And then January to May, which I went ahead and updated it as of today. So we have 232 reports received and 125 reports evaluated.
So we're
we
tracking
stay
about the same, yeah?
Yeah. Now, we're having growth in other departments, but as far as that. And neglect is the most commonly reported and the most commonly confirmed. And of the two, because we have self-neglect and caretaker, self-neglect's the most common. So, and then there's our staff. We're actually have one vacant position right now for an APS social worker. But Jean does our intake, and then Mike, Josie, and Brittany do our evaluations and services. So we have a really good team, so
Yeah, y'all do a great job.
it's sometimes hard to understand because we
Yeah.
can't just go in and take someone. We have to have extreme circumstances.
Yep.
Any questions?
Anybody got any questions?
Thank you for all you do.
All right. Thank you, Beverly. We'll move on to, do I want to say this? Yeah, I'm going to say it.
We add.
Yeah, we add.
Yeah,
Walk for we add.
yeah.
Miss April Williamson's going to talk to us about that. So,
Yes, so this past Saturday, we had an elder abuse awareness walk for our Elder Abuse Awareness Month. The actual day was on the 15th, that was last Sunday. So we walked this week, it was a success. We had around 65 people to attend. We had 8 booths that were there to talk about their resources and way they try to stop elder abuse. We were able to all make social connections with the people that were there, so our Caldwell County can stay on the same page as far as trying to prevent elder abuse. We served lunch, burgers and chips and drinks. It was great. We had cookies from Kendra's Bakery. That she made the little signs of the
Little
ribbons,
ribbons,
the
yeah.
purple
the
ribbons.
purple ribbons,
Yep.
yeah.
So I just really would like to thank our sponsors. Our sponsors were Sandstone Health and Rehab, VIA, Senior Center, Greenway, RHA, Res Care, the Granite Falls Rec, because that's where we had it, Hopscotch, and then Kendra's Bakery. And we had some pictures. It goes by quick,
Awesome.
but it shows that we had a lot of fun doing this, and hopefully next year it will be bigger than this year.
And cooler.
I think
Thank
we
you.
need
It was hot.
It was
to
very
add
hot.
One good thing about this walk is all the money that was left over after the event has been donated to the Will Wakefield Adult Services Fund. So the money is staying in our county to help our
Our
senior
people.
citizens.
Yep, that's awesome.
Yep. So
That's great. Thank you, Miss April.
Thanks, April.
All right, next, one of the moments of, the highlights of our meeting every month is Chris Conley, our business officer. He's going to share with us all some exciting,
Speaking of news,
Information.
Chris, you take it from him, don't you?
yeah. Y'all ever watch the Andy Griffith episode? Any of y'all watch Andy Griffith?
Yes,
Surely I ain't on one.
Yeah.
The dry as dust, preacher's dry as dust.
I don't remember that, but
No, you
I,
don't remember that one? Yeah, so the financial reports,
Thank you, Donnie. As
dry as
always.
dust,
it's exciting.
as
It'll be
the
a little
preacher used to
more
say.
interesting today, right? It's gonna be a little more interesting
It might be
today.
more interesting today.
Yeah. So, yeah, we'll quickly cover our numbers for May, and then Kim has some other things she'd like to discuss. Our reimbursements for the month came in at just over $928,000. We ended the month with receivables of almost $1,750,000. Expenses for the month were almost $1,354,000. So our county dollar utilized in the month was just over $425,000. Looking at year-to-date compared to prior year, expenses are up 1.4 million. revenues are up just over 200,000. And this number is skewed, and I'll explain why in a moment. So our county dollar is up more than 1.2 million at this point in the year. That is because in May of '24, we received 2 months of administrative revenues, and then that's our big revenue source, and catching us up at that point in the year, whereas this year there was only 1 month of those revenues received in May, and we're still a month behind, as we have been all year. So last year, May revenues exceeded May 25 revenues by $660,000. So if you simply subtracted that amount from the 1.2 million, we're at about 550,000 above last year's county dollar, which is what we would expect at this point in the year. So do you have any questions about those numbers?
The only question I got is how we're going to land overall for the year budget-wise. We're going to be over, under, flat?
Well, okay, as far as our budget, we're within budget everywhere in our budget.
Yeah.
I mean, we're not going to overspend anywhere.
Good.
In comparison to last year, yes, we will spend more county dollar. That's for two reasons. Yes, some expenses have increased, but also revenues have decreased in some
Correct.
areas. So that increased county dollar is not reflective of just expense increases. It's also affected by reduced revenues.
Yeah.
And so, yeah, our county dollar will be up. Our total spending will be up compared to last year, but we'll be within budget. I mean, we're not.
And a lot
in-
of that's, most of that's due to salary increases throughout the year, wasn't it? A big portion of
A
it.
lot of it, but something I pointed out to Kim recently, with our foster care room and board payments,
Yep.
we've been talking for the last couple of years about how the lower fund source, the state funding, which is only reimbursed 50%, how more kids are only eligible for that as compared to the 4E funding, the federal funding, which is 80% reimbursed. So we're getting less reimbursement on the room and board payments, but that also affects our administrative reimbursement for staff costs. There's less staff time covered by that 4E funding, whereas in past years, we'd draw $42,000 a month in 4E reimbursement just for staff cost. That's coming in right at $30,000 a month right now.
Yeah.
So expense didn't increase, relatively
revenues coming
speaking,
in
but
lower.
revenues have decreased pretty
Yep.
significantly for those administrative reimbursements. So again, county dollar affected not only by increased expenses, but decreased revenues
Yep.
as well.
And I think something to point out is that bridge funding that we're currently getting right now, that we
About
don't,
15 grand a month.
and we don't know that will continue after next year,
Yeah.
correct? And that is that funding where our children are eligible for 4E for only 14 days in a congregate care setting. And then after that 14 days is over, it goes to a state fund, or state funding. And so it reduces that revenue. And so we're getting that bridge funding to make up that difference right now at that rate. And after this coming year, we don't know that we'll get that again. So we'll see that increase, we'll see revenues drop again.
Yeah, potentially, yeah.
Yeah. So,
I think we can pretty much count on that happening.
Yeah.
yeah.
Anybody got any questions for Chris? You good?
Well, I'm going to talk about
Yeah.
something to
Okay.
do with our budget, unless you're not finished.
Just to let you know, give you a heads up, we've modified this report, so it'll be in a different format next month, similar
Okay.
to our program reports where you see 3 months of data. So it'll just look different next month.
Yeah.
Same information, actually more information, but we think it provides you with more and is a little cleaner to look at as well.
Yeah.
Yep, okay.
So I want to talk real quick about I know I've been talking about the proposed legislation for SNAP and Medicaid. I just want to keep talking about it as the changes come about. So recently, actually as recent as today, I got some information on the Senate parliamentarian. They've approved the Agriculture Committee's revision of some of the SNAP cuts and cost sharing. Now, right now, the Senate still has to vote on it, and they're looking at trying to get something passed before their recess on July 4th. So right now, as of today, What they are looking at is a combination of administrative cost sharing and benefit cost sharing for states. And so the benefit cost sharing means because states have never had to pitch in for the benefit cost share of food nutrition benefits. They're looking at states having to do that now if your error rate is above 6% for the state. So that doesn't matter county by county. It only matters overall for the state. And I think our state is around 8% right now, a little over 8%. So if there's a county that's really falling behind, then it's going to affect the entire state. So what we're looking
So
at.
if we're doing a good job and other counties aren't, we're going to get penalized.
Right, the whole state will be affected.
And the larger counties.
What's that called
will-
again?
It's cost sharing, benefit cost sharing for SNAP. And right now, what they're proposing is if you have an error rate below 6%, your cost share would be 0 for benefit cost sharing. If you are between 6 and 8%, your cost share would be 5%. And for North Carolina, my understanding is the error rate is a little over 8%, and that would put us at 10% cost share. So Chris ran some numbers, and for Caldwell County, we spend around $2 million a month in benefits for food nutrition. If we are looking at a 10% cost share, and I'm going to let Chris take it from there.
Well, it'd be about 200 grand a month. The county, 200,000 grand a month, the county would have
So
to kick in.
we're looking at 2.4 million for the year.
Yeah.
So that is as of today for the benefit cost share. They're also looking at administrative cost share, which means the time that we spend administering the program, that our staff spend working on eligibility and doing the paperwork and interviews. So right now, we get about a 50% reimbursement on their time.
Yeah, it's a flat 50.
What they're looking at is only 25%. And so that would then equal around $555,000 a year. So we're looking at a $3 million difference in our county dollar
Total.
for this program per year.
So in other
Now-
words, we need to find out who these failing counties are and get on to them.
Well, that is one of the purposes of this proposal is to try to increase accuracy and reduce error rates.
But let me ask you this question. Do you know, have they give you indication of why they're going that route? Because why would they hold a county who's doing it right hostage over a county who's doing it wrong? I mean,
Well,
to me, that makes no sense.
if the state comes up with.
There's got to be some logic behind their thinking, I would think.
Right, and this is at the federal level.
Yeah.
So if the state comes up with something different, and looks at it per county, I don't know if they'll have that flexibility. I don't know if if they'll have the
Well, they
flexibility
won't if
to.
the feds do it, probably.
Right, and so I don't know if they'll be able to say, okay, the state has to, chip in this money, and we're gonna look at it, we're gonna get our money, the state's gonna get their money in a certain way by looking at counties and differently depending on their error rates. I don't know that they'll have that flexibility.
That would be nice.
Right. So now they're looking at this happening 2027, around 2027 and 2026 for some things. And so we do have some time. Chris and I do have a meeting with Wayne, our interim county manager, on Friday, just to talk about this, so that we can bring it to his attention. And I think Tony's going to join us so that if, he feels he needs to bring it to the commissioners, just to say, hey, heads up, these are some things that are being talked about, and this is how it might affect the county budget if it goes this way. So we're going to do that on Friday.
But we don't know that it's going to go that way yet.
We don't know for sure. The House recommendations were actually a little bit stricter than the Senate.
US House, right?
Yes. We're a little stricter than the Senate. So the House was wanting a 5% minimum across the board for benefit cost sharing for each state. And these recommendations are if your error rate's below 6%, then it's 0 cost share. So there are some differences, and so we'll see where it lands. But as of today, that's what the recommendations are.
Do we have any idea where our error percentage is
It's around a little over 8.
currently? We are.
I don't know about county.
That's what I'm talking about,
But
our county.
state,
The
yeah, I
state's at
don't,
8.
we would have to look at, to see if they calculate it by individual counties and what that would be.
Do we know how many counties across North Carolina are below the threshold?
No, I don't know that. That's something we might could find out, but I would have to contact the state to see if they could give us that information.
It just bothers me that we're gonna get penalized because somebody else is not doing it like they're supposed to do it. If we're doing it right and they're doing it wrong, why
Right.
should we get penalized?
Yeah.
And maybe states will
That
have
makes
some
no sense.
flexibility. I don't know. But I did email you all this
saw it.
information, so you can go in and look at it if you want to. But I mentioned that we would be talking about it tonight.
All right. Anybody got any questions? Chris, as always, man, thank you for all you do.
Thank you.
We couldn't do it without you. You do a great job. Keep us out of the ditch. All right, next is the Director's Report. Kim Arnett, Director.
So, following up that information, I'll talk a little bit about the Medicaid proposed legislations.
Good old Medicaid.
Good, yes, and so we are expecting that work requirement to go into effect. It's not been set yet, but it's part of the reconciliation bill. We are looking at potentially work requirement for 19 to 64-year-olds. It was 19 to 54. Now they're looking at 19 to 64. There are some exemptions. Parents with children under 14, they're looking at making an exemption for. They are looking at allowing states the option to delay this implementation for 2 years. So don't know what North Carolina will choose to do. Also, they're looking at a 6-month recertification period instead of a year recertification period. And what that means for us and why that's important to really think about is our workload for our staff will then double. Because instead of doing these recerts once a year, they're going to be doing them twice a year.
Yeah.
So that is something for us to really consider. And looking at work requirements, and when we're evaluating eligibility, evaluating for work requirements is going to be an added layer. So that also will increase our workload. They are also talking about reducing the federal share for states who allow certain populations to be covered by Medicaid. And so if that happens, right now, North Carolina is a state that allows certain populations to be eligible for Medicaid. And if the federal share gets reduced at all from 90% to anything lower, there is in statute that Medicaid expansion could potentially go away. So, North Carolina will have a decision to make about whether or not they're going to cover certain populations with Medicaid. And so, of course, that's not anything for the local government to decide. That will be on a state level, but that is in part of the proposed legislations.
Yep.
So just wanted to
But
keep
it
you guys.
does push burden back down to us.
Yeah,
So,
yes.
it's the more you listen, the more you get involved. It's all these from the federal and the state levels, all the unfunded mandates that make all these changes, and they force us to do it and force it back on the local governments. And unfortunately, our taxpayers are the ones that are having
Right.
to suffer that burden. So,
Yeah.
but there's not much you can do about it other than be vocal and try to advocate for what you want, the changes you want.
Yeah.
And that's one of the things that we're in a situation where we have great relationships with our representatives, both in the U.S. Senate and the U.S. House, and as well as the local North Carolina House and Senate.
Yeah.
So I hope we're working with those local legislators to try to voice our opinion either through.
And we are, as a directors association, I know we have a committee
Yeah.
that works closely with our representatives. And so
Yeah.
they definitely are verbal about what our needs are and how this legislation is going to affect everyone on the local level. I'm going to talk real quickly.
We just got to make sure that the association understands they got to get to the right legislators.
Yes.
The ones that have a stronger, bigger voice. A lot of times I've found that a lot of the associations have been kind of doing it the same way they've always done it. They don't really get to the right person.
Yeah.
So
I'll talk also about our budget for this upcoming year. We were able to have two of our reclasses, or two reclasses approved for the, in the budget. One was reclassing an IMC, our income maintenance caseworker position, to a child welfare staff development position. So we're very excited about that because we right now have 7 staff, or I will say trainers, in income maintenance and only 1 in child welfare. And so that's going to be helpful. We'll have another 1 in child welfare who can focus on our permanency foster care area. And I think that's going to be very helpful. Also, we were able to offset some cost with that reclass by reclassing our program administrator position to a deputy director position. So we were able to reclass that position, which I think will be very, very beneficial to the agency. We also budgeted for 4 vacancies across the year. Our turnover rates usually stay pretty consistent, and so we felt like that was a safe number to budget for. Now, what we will do on a monthly basis is we will look at that and we will track our vacancies and we will track our lapse salary and make sure that we are in good standing in our budget. If our turnover is less than what we expect, that's a great thing, and we will be bringing that to your attention and also the commissioner's attention if we need to make any kind of budget amendments in that area. In child welfare, I'm going to talk real quick about our emergency placement funds. We got last year some emergency placement funds for foster children. And so these funds were for children who have been leveled. So they have some behavioral mental health issues that have been diagnosed and looking for a leveled placement, more of a therapeutic placement. And these emergency placement funds were there to help with temporary placement. So sometimes we had to pay additional like an additional amount, an enhanced rate for these placements, or maybe we had to pay someone to keep this child while we're waiting for a leveled placement. Just a variety of things that we were able to do with this money. What we heard recently was that we are going to be able to carry over the money that we haven't spent to the next fiscal year. So that's been very helpful because we were worried we weren't going to get any more of that funding. So last year we got around 49,000. We spent around 13,000. So we're hoping, if everything goes to plan and as I was informed, we'll be able to carry over about 36,000 of that. So now after next year, we don't know what that's going to look like, but we're happy that we are hopefully going to get to carry that money over.
Good. Okay.
And that's all I have.
Anybody got any questions for Kim?
Nope.
No questions? All right. Next is going to be Child Services. Laura Harrison, the Child Welfare Program Administrator. Is she officially the new deputy dog yet?
July 1st.
July 1st.
She'll get a
So we can
badge.
call her deputy dog?
Yeah. And a hat.
Get a little badge and a
Yes.
hat?
Mhm.
Perfect. Can't wait.
We can't have a
wait.
gun.
And if y'all don't do that, I'm gonna be very disappointed in you.
I blame Beverly for this.
Yeah.
She's the one that mentioned this the other day as well, so.
So, I didn't know somebody else mentioned. I just made it up tonight.
So now
Okay.
you can blame Dawn.
So I'll wear that to the next meeting. I'll have my star badge and
Hope you
some
do.
kind of
Your hat.
hat.
Yep.
Jeez.
I'm counting on you girls to make that happen.
Okay, so the numbers are up. As you can see, we saw a pretty sharp increase in the number of reports that we took, as well as the number of reports that we screened in. This was the highest numbers that we've had since February of 2023. And I will let you know that law enforcement was our #1 reporter for last month. So other than that, we've looked at numbers. I know at the end of the year, school year, at the end of May, I know it didn't end technically till the 1st of June. But a lot of those reports were also, law enforcement didn't, come in real far ahead. So just so you know, education was a strong reporter as well. But typically we do see an increase, just not this big of an increase.
Any idea what caused it? I mean,
Nope, I knew you were going to ask me that, and I
Okay.
don't. Leah,
it's interesting that it come from law enforcement, which is a little bit of a concern,
we've had a lot of violence going on this past month, it seems, in the
I've
community.
noticed there's been a lot more, seems to me there's been an increase in domestic violence, arrests and stuff. I've tracked I know y'all probably think I'm crazy, but I've watched I try to watch who's been arrested for what, just to try to get a visual of what's happening in our community, like is it drugs, is it, failure to appear for traffic tickets or whatever it is, but I've seen a lot of domestic violence, more so than I usually see, so.
Yes, and that
Found
would
that very
account for
interesting.
most of our reports from law enforcement
Yeah.
are domestic violence
Yep.
reports. The other numbers you'll see stayed pretty much consistent with how we have been for the quarter. Any questions about the numbers? So the highlights, I will say, a couple weeks ago, earlier in the month, we were in the office with a lot of children, unfortunately, that we had taken custody of. We had 7 kids in our office at one point for a couple days. Thankfully, only one had to stay overnight for a couple days. The others were able to go to a foster home for the night, but then stayed with us during the day. And these children were had special needs. And so one child had a feeding tube, so there was a sibling group of 3, and in that sibling group of 3, one child had a feeding tube, and 2 children in that group have diagnosis of autism, and so they're not verbal, able to tell us things. We had another sibling group of 3, and 2 of those children were on oxygen. I also had special feeding needs, and then their sibling was old enough that they should be able to walk and talk, but was not able to. And so just a lot of time dealing with that. And so we did a lot of collaboration, not only within our agency, within child welfare, but within the entire agency, pitching in and helping out, but also with the fire marshal's office. So Kevin Brown, and I'm sorry, I don't know his real name, but Zippy.
I know who he is.
Shane,
Yeah.
Both of them helped us.
Nobody knows his real name.
It just hit me because I couldn't remember it a while ago, but it just hit me. Yeah.
With the feeding tube need, and so Kevin actually gave us a tutorial on that. He has some experience with that.
Yep.
And Zippy was there overnight and, said, I'm available if you guys need something, please let me know. So we're very thankful for them, offering that support and help. But that collaboration and having that, and in the same building, that was very helpful to have as well.
Yeah, it says a lot about Zippy and his willing to step up, and, you don't see many fire marshals that's willing to come stay with children like that, so
Yeah.
that says a lot for him as an individual.
Yeah, he was going to come down and do the feeding for us if we needed it.
Yeah.
So that was, because, that's not really our area of expertise, and so, yeah.
So are we, I know we've got an area kind of set up, but have we really got a good area to set up to take care of these people, or do we need to be looking at,
Well, we have.
because, this ain't going away.
Right.
Right.
So we have 4 what we refer to as visitation rooms. And those rooms are, they have sofas in them, they have toys, they're, rugs, lamps. They're more welcoming than an office. And then one of those, we have a recliner, we have a sofa that turns into a bed, and it's not your normal, couch pull-out bed. It's more of a futon bed, and we also have a TV in there and some lamps, and so it's cozier than the other 3 visitation rooms, and that's where our 16-year-old actually spent a couple nights there, and so that's what we have. We don't really have space to do much more than that, other than maybe getting a sofa another sofa that turns into a bed, because all of our offices are full.
Well, I know we got on the 3rd floor up there, we got all that space that we have to store stuff in.
Oh yeah, unfinished space.
Yeah,
yes,
that's what
I'm
saying,
just
is there-
talking about more.
this isn't gonna go away, so
Right.
should we be looking at preparing and creating a space that's comfortable and, just 7 kids is a lot.
Yeah, and-
one's a lot. You
Yeah.
got 7, and a lot
Yeah.
of them have special needs. Are we really,
We're certainly not equipped for that.
No.
And it's
should we be looking at that? And could we, I just feel like there's a better way. Are we getting by? Yeah, but are we doing it? I don't know the word I'm looking for. Is
Yeah.
it-
Would it be more beneficial just to have another pull-out sofa? So you don't have the need to find another room, or what would you really
So
ideally
I think that's
like?
something we can talk about. you know, having 7 kids in the office at one time is a rarity.
Right.
Typically, and I hate to say, I know everybody knock on someone. Typically, we have one child in the office at a time, maybe 2. But I don't know that we've had more than that at one time. And so, you know, I think I'm hesitant to say we need to look at finishing an area just for that purpose. Do I think having another sofa that pulls out and that we could transform another room into a bedroom if needed? Yes, that would probably be beneficial.
Well, we have a great maintenance department. They do some really good work.
Yeah.
So, I just want to make sure that we're, wish I could come up with the right word, but we're not just getting by.
Yeah.
And
And we're not,
I mean,
I think with
I'd like for these children that already got a lot of trauma in their
Right.
life, right? I mean,
Yeah.
they come somewhere, are we just sticking them in an office and, you know,
yeah.
But
putting them in a
she
chair?
did
and-
say though that 7 is rare.
Yeah, it
So I
is.
think we typically have 1 or 2.
But we
Yes.
typically,
And
but
we
we have had siblings, I mean, when you have
Yes.
2 or 3 at one time.
And so we do, and again, those visitation rooms are not like an office, so they're more like a living room
Yeah.
area. So we're definitely not just sticking them in an office.
I'll come over and look at 'em.
Okay. And
I've seen them, they're nice.
yeah, and so what I will say though, is it's never going to be comfortable in that setting, and that is what we try to avoid at all cost, is having a child in the office overnight. And that's something we're trying to push with the state diligently, that this is not where they need to be. Number one, most of these children have therapeutic needs, and we're not equipped to handle
Yeah.
therapeutic needs.
Yeah.
People have special training to handle children with therapeutic needs. And so we try really diligently to not have children in our office. And I will say that our staff do a tremendous job at making that happen. Now, tomorrow we may have a child in the office, but it will not be because our staff do not try
Oh, no, I know
diligently.
that part. It's
So,
not staff's fault, they just ain't nowhere, there's just nowhere to send them.
right,
It's just,
right.
you know, but when you start getting kids with, it scares me when we got kids with feeding tubes and oxygen,
right.
that scares me a little bit.
It-
Because
and
we're
it-
not set up for that.
And it did
Right.
us, and so I think that was very unusual, and so that's why we pulled in someone who knew about that, like, what do we do with this
Yeah.
situation, and how can we help? And I think Casey wants to say something.
I
I don't know why I
What
think
what
that.
gave what gave
I
you
don't
that
know,
idea?
just as someone creeping up in the back.
Yeah.
Especially me.
Yeah, creeper.
I just want to reiterate, that's one of the reasons that the emergency placement funds from
Yep.
the state have been so important, is
Yep.
because that allows us to pay extra to foster homes so that they can take care of the more harder to place children. But also, you know, we're fortunate in that we have our visitation room set up the way it is, and we just do have one. But it is welcoming. There's a bathroom right off of it. We also have a full shower. We have washing facilities so that we can take care of their clothes. They can access the internet. We've got our workers who can be on the floor with them so that they're not constantly having to move away and go take care of children in another location. So it's actually fairly convenient and functions really well for short periods of time.
Yeah.
Correct.
Yeah.
As long as we're not overwhelmed with
7.
7 children at one time with
Multiple,
special needs.
yeah.
So that was unusual, but our workers do,
Yeah.
and our staff really do.
They do.
Such
Oh,
a
they're
good
awesome. I
job.
just,
And we are lucky that we have a placement coordinator that
Yeah.
helps us too.
Yes.
And so she does a good job helping all of the social workers, because social workers not only have this